2 points I think we should follow up on that is, I think the first thing is most urologists, can't say everyone, are probably not giving infusion PD-1 inhibitors in their clinic, right? So this, I think, should hopefully allow that hurdle to get removed. So we can maybe be giving it in clinic. The flip side of that is I don't think urologists are very comfortable all the time managing those type of side effects, right? We don't see those infusion PD-1 inhibitor patients. We're not managing those AEs. And I think that's something that we're probably as a field going to have to learn, because I think the field is looking at more, advanced immunotherapy agents in this regard, right? And I think this is going to be one of the areas. But touching back on a point that I mentioned is, we're seeing a lot of that signal in CIS patients, right? But what was really interesting, I believe it was either AOA or ASCO, came out was cohort 4 for SunRISe-1, which was in the papillary disease. So talk to us a little bit about papillary disease and how maybe we would use some of this new data to treat that.
Yeah, so SunRISe-4 was SunRISe-1
With one cohort
cohort.
4, right.
That was looking at kind of an understudied space
Mhm.
because of the FDA and registrational trials. Most of the attention is for BCG-unresponsive CIS, and some
Right.
of the trials will have a papillary cohort as well. So that's what they looked at. It was about 50 patients, I want to say, with BCG-unresponsive papillary disease. And they had relatively short-term outcomes. They reported the 6-month recurrence-free survival and the 9-month complete recurrence-free survival. And the 9-month was 81%, which is very good.
Yeah.
I think you have to keep in mind that it's always going to look much better than the carcinoma in situ because we are
Yes.
surgically able to remove the disease.
Right.
Um,
Because we can see it. I mean, that's one of the main reasons, right? We're able to visualize papillary disease much easier.
Yep. I think it's promising. It's interesting. It's small numbers and it's short follow-up, so it's hard for me to make any definitive statements on how excited we should be about this. But it looks pretty good. We have some new retrospective data that looks at gemdosi or BCG specifically in a papillary population, and 1 year complete response is somewhere around 70 to 80% as well. So clearly a more surgical disease where the adjuvant therapy plays relatively less of a role compared to CIS, but I think it's very exciting data.
Yeah. And I mean, I think the what I found more exciting was less the data, but more the fact that there's a shift now towards papillary disease.
Yep.
And at least, in our area, our practice, I predominantly see papillary disease. I mean, I think, probably 20%, if not maybe 25% of my patients have CIS, but a majority are definitely papillary. So, it's exciting to see that, the field is moving towards using these therapies and, seeing how it's going to work towards that type of disease state as well. So I think that's really the newest evolution of this, and I'm really looking forward to that data as well.